So, hi, this is Dr. Matthew Zires here at the SDPA Hot Topics in Dermatology podcast. So this is a weekly series where I will be being taught about a hot topic in the world of dermatology by one of the phenomenal dermatology physician assistants that are members of the SDPA. Here this week, I've got Francine Phillips with me. And Francine and I have known each other for a long time. I call her Franny. So Franny, tell me how you ended up in dermatology.
Okay, so let's go back. I had a lot of acne growing up.
Okay.
And I also have psoriasis. And I currently still have acne, so.
So I did not know either of those two things about you.
I know, we've known each other a long time.
Okay.
Yep.
And did you know when you went to PA school that you wanted to go into derm whenever you were done?
Absolutely.
And did you manage to get straight into derm out of PA school, or did you have to, work in another field until you were able to get a job in derm?
I worked with cosmetic lasers,
Okay.
and then I met a dermatologist that invited me to come work with her, and
Okay.
that's what my ultimate goal was. So
Okay. And how long have you been in derm so far?
18 years.
18
Yes,
years. So
I'm
you
old.
started when you were 14 in the world
Yeah,
of derm?
somewhere around there.
Yeah, that
I'm
sounds,
old.
That sounds about right. So, and what is your favorite part of working in dermatology?
So for many years, I treated a lot of pediatric patients, and
Okay.
I love the kids. I love them. But now I see 12 and up.
Okay.
Acne is still one of my favorite things to treat.
Okay.
I've done tons of acne and psoriasis and lots of cosmetics, and I still go back to medical derm.
Okay. So that brings up, so the topic that I'm excited to kind of hear about today, so there was a recent article about how providers follow and monitor people on spironolactone. I am primarily an eczema guy.
Oh, come on.
I'm vaguely competent in things other than eczema, but I am
Yeah.
certain that you have treated enormously more acne than I have, and have used enormously more spironolactone than I have. And so, tell me your take on this article. So it really was about how should we be monitoring? Do we need to monitor? Just tell me your thoughts on it.
I found the article really interesting. I personally don't do lab monitoring at all. I did for a short time early in my career, and I found that wasn't beneficial. I never had to take anybody off, and so why stick somebody?
And
so I didn't. So in this article, it's very interesting that at the end, it was found that a lot of NPs and PAs actually monitor more now than they did.
Yeah.
And dermatologists do not.
Yeah. And so first, I will tell you that I am exactly in your boat. I generally don't do any labs whenever I'm starting somebody on spironolactone. I have a couple of hair loss patients that are like in their 70s. And in that situation, I probably will, but not when I'm treating.
Well, they're on like 200, right?
Yeah. So they're on a significant dose.
Right.
And so when you're and first I also found it fascinating that PAs and NPs are doing more monitoring than dermatologists, and it always goes back to one of the things for me. I think that you guys are held to a higher standard than dermatologists are, meaning that if something ever happens to a patient, it's easier for people to say, well, that PA or they didn't know what they were there, and so
They didn't draw labs.
right. They didn't draw whereas if a dermatologist does the same thing,
Right.
there's more leeway given.
Right. But it also could be standard of care for that practice. Like if the dermatologist doesn't see acne and the PA or the NP does, sometimes the collaborating physician is like, anyone you see that's on spironolactone, I would like you to get labs at whatever.
Yeah.
I found it interesting in the article, it didn't specify a dose.
Yeah. True.
Like I kept looking, I'm like, am I missing the dose? And I never saw the dose. And so I'm curious. I take spironolactone I take 75 milligrams, and I've been on it for 10 years. Like I said before, I have terrible acne, and without it, if I miss a day, forget it.
Yeah.
So And I'm fine. And I naturally have low blood pressure,
Mm-hmm.
and I'm fine. So I didn't see a dose in there. So
Yeah.
I was kind of,
Well, let's go to tell me first the kind of patient that you most commonly are using spironolactone in.
so my adult female patients, the ones that come in, I've never had acne and now I have acne. And then there's a small, subset of patients that are like 18, 20.
Okay.
I've never prescribed it for anybody really under 18. Not that I wouldn't, I
Yeah,
just didn't.
Okay.
And those hard to treat people that, they don't want to come off an antibiotic
Yeah.
or they don't, they're irritated from using all the creams
Yeah.
and they don't want to do that.
Do you think of spironolactone as your first line agent for adult female acne?
Yes.
And that makes sense to me.
But I'll tell you why.
Yeah.
It's dirt cheap.
Yeah.
I don't have to fight with any insurance companies on getting some of those new medications that I love and I want to,
Yeah.
I try them and I try to get them approved.
Yeah.
Obviously access is always an issue, but I will start them on that.
Okay. Do you find that spironolactone is often adequate as monotherapy? So let's say a new adult female acne patient comes in, not been on anything, maybe they've used some over the counter, benzoyl peroxide, whatever. That first visit, are you likely to start them on just spironolactone, or are you likely to start them on spironolactone and atopical?
Well, I do like a retinoid for
Yeah.
anti-aging and other things.
Yes.
So I think everyone should be on a retinoid.
Okay.
Side note.
Okay.
But back to spironolactone, I really, obviously, if they're childbearing age, I'm really big about you have to be on some form of oral contraceptive.
Okay.
That's a big deal for
Yeah.
me.
Okay.
I do not go
Yeah.
with the abstinence line from anybody in that
Okay.
age group. Sorry.
That's interesting. That's
Yeah.
something that I haven't. It's not something that I worry about a whole lot, and maybe I should be.
I had a GYN call me once, and
Yeah.
that was it.
Okay.
There was a patient pregnant, and she was on birth control when
Yeah.
I saw her, but she had come off and was still on spironolactone and got pregnant. So the OBGYN gave me a call and
Yeah.
said, "Hey."
Okay.
So that was my only time with that.
Yeah.
But
Yeah.
in my note, she was on birth
Yeah.
control.
Okay. And so you're probably going to start them on spironolactone and a retinoid if they're not already on one.
50 milligrams.
50 milligrams is your starting dose. What's your spiel? So how do you? Because spironolactone, if they get the package insert from the pharmacy, they're going
forget
to say
it.
it's a diet. So what do you tell? Like, how do you explain spironolactone?
I have it down to a T now. I'm like, there's a great medication. It's off label. It's a blood pressure medication. When you pick it up from the pharmacy, throw out that insert. I'm going to give you everything you need to know. And, it's interesting that your patients, when you say, you need to stay away from a lot of potassium, tell them it's potassium sparing, they think it's just bananas. I'm like, oh, no, there's actually, to be fair, I didn't know coconut water has a ton of potassium.
Okay.
Big time. It's like 600 milligrams a cup or
Wow.
something. Yeah.
Okay.
It's a big, and potatoes, sweet potatoes, white potatoes. There's other things. Tomatoes, big.
Do you have like a list in your head? Do you tell them Google high potassium foods?
No.
What do you?
I kind of just tell them, listen, don't have 12 bananas.
That makes sense.
I'm like, listen,
Yeah.
just don't overindulge. I really haven't seen a problem with anything.
Yeah.
I just kind of say
to be
moderation
on
is key. I
Yeah.
have never had an issue in all the years I've
Okay.
written it.
And are there any? So, all right, you tell them.
I tell them about breast tenderness.
Okay.
I tell them their breasts may become bigger, which most women are like, heck yeah, I'm
Good with
in.
that.
Yeah. Spotting with their cycle.
Okay.
But most of the time, I would say if they're on birth control along with spironolactone, they may not have a lot of those side
Okay.
effects.
Okay. And so you said your starting dose is 50 milligrams, and then how long do you give it before you see them back and decide I'm going to keep you on 50? I'm going to bump the dose up. What's your?
So I typically see them back in 10 to 12 weeks. But what
Okay.
I tell them is, I'm like, listen, in about 3 or 4 weeks, you may start noticing a difference. I
Okay.
said, but give it the whole, 10 weeks. I also tell them to drink plenty of water.
Okay.
I have had one person get disimpacted in the ER.
Wow. So they got
They'll
dehydrated
never,
enough.
they'll
that-
never do that
Yeah,
again.
they'll never, ever do that again.
I mean, she
Yeah.
was a cute little girl, and she was probably
Yeah.
20. She was like, oh, you should have seen the cute guy that was disimpacted.
Wow. Oh, that's terrible.
It was terrible.
And what dose do you think you most commonly end up having people on?
So I would say 75.
Okay.
I have a couple on 100. I don't think it's weight-based, but I find that if people weigh a little more, that they're in the 100 milligram
Okay.
range. And I don't know.
Yeah.
That's just kind of my experience.
And if you go to 100, do you usually do it more as 100 once a day or 50 twice a day? Do you think there's any
Nope.
difference?
I just have them do it. But I only have probably 3 patients on 100.
Okay. All right, got it.
Anything above 100, I would draw labs, but I'm not doing that
Yeah.
for acne.
Yeah.
You know what I mean?
Yeah. Okay. So I now feel more comfortable and confident in using spironolactone, so thank you.
Look at you.
Is there anything we haven't talked about with spironolactone that you think is important for other PAs in the SDPA to know? Anything? And obviously we didn't go into, we could do a 1-hour lecture on spironolactone, so it's not like this is comprehensive, everything you could possibly need to know. But anything major that we didn't touch on that you think we should?
I did read, and I did not know this, that you should take it the same time every day and that it does work more effectively.
Whenever you take it at the same time every day?
So I have never told my patients that. I'm
Yeah.
like, just take it.
Yeah.
So
Interesting. Huh?
I learned something new.
Okay. Probably, and the one thing, just in case any of our listeners are not, so you really did a great job talking about the importance of avoiding pregnancy while on spironolactone,
Yes.
and where that comes from. There is a theoretical risk of if somebody has a male fetus, it getting feminized by the hormonal blockade of the spironolactone. That's really the issue with that. And then do you ever have patients ask you about if there's, since it's blocking androgens, does that increase do you have any patients who ever ask about increasing the risk of breast cancer?
I
or anything
haven't,
like
but
that?
I have read, obviously, that in high doses that it has produced breast cancer,
Yeah.
but there is no
Yeah.
study saying that it is.
That it does in the doses we use in acne.
Correct.
The data has been it doesn't have any increase.
Correct.
But yes, in high enough doses it
Correct.
could, long enough term.
And then you do not give it to men.
Yes.
They will get breasts.
And they don't like that?
And they don't, most
like
don't
that?
like it. I mean,
Okay.
you know.
All right, fair enough. Well, thank you so much for coming on
thank you.
today.
Thank you for having
loved
me.
getting to learn more about how you use spironolactone, and I hope that our listeners are going to find it super helpful.
Love it.
All right.
Thank you.
Thanks, Franny.